everybody, David over the plan. And welcome back. And once again today, I'm with my friend and a friend of the channel, Christian Logan. How are you today, Christian?
I'm well. Thanks for having me again.
Oh, anytime. You're always welcome. So what we're doing today is I brought out my first aid kit, and as we all remember, Christian here is a medical professional to a point.
Yeah, to a point.
He has extensive training and teaching capabilities in wilderness medical treatment. As training in wilderness first aid, urban first aid, and first aid for preppers, things of that nature. So I asked him to roast my first aid kit and see what he thinks. Have at it.
And you know what? If there's a roast to be had, we'll roast it. If not, it may be something you put together well. Are you O positive?
I am O positive.
So am I. So, but all right. Well, first off, do you keep it with you all the time?
Almost all the time.
That's already a huge step. All right, let's see here. We have an Israeli bandage.
As you bashed them earlier.
Yeah, one-trick ponies. Better than nothing. Nothing wrong with it. But especially in dealing with, say, in EMS with my world, at fire rescue or on the ambulance or hiking wilderness medicine, for me, ounces make pounds and pounds make pain. I don't like one-trick ponies. This is a pressure dressing. This is an Israeli. Funny story. Years ago, my mailman, who you knew, shows up at my house with a package that has Hebrew on it. And I'm like, I don't know anybody in Israel. I do not. No, you stay right here while I open this package. I'd forgotten that I'd ordered some Israeli dressings, and they came from like Tel Aviv. Like
yes.
They were straight up Israeli, and it's all with the. I don't know who this is. I'm not opening it by myself. I need a witness. So anyway, this is a pressure dressing. It's got a wound cover on it, and then a wrap, and then a plastic clip. As you wrap it, you cinch it down, and then clips on the end of the dressing that is designed to hold it in place when it's done. Problem being, a lot of that, the plastic can break. Those clips can break, and it is designed just for that. I personally, and I'm not a spokesman or for any of this, they don't pay me, but the Oleas, O-L-E-A-S, the Oleas dressing, it's about the same size. They're maybe $2 more per unit, has a pressure dressing in it. It has a plastic cup that it can either be used to form pressure on it, or is it an eye wash cup? Inside the pressure dressing, so if you can imagine, there's a dressing that lays over the wound. It's all rolled up, and every 6 or 8 inches, I forget which one it is, inside that roll is a strip of Velcro. So when you pull it out, that roll doesn't fall out into all the dirt and blood or whatever. You can put that dressing on and roll it to get it tight, right? Also within that wound side is a piece of plastic that comes out, and it's 6x4. They can be used as an occlusive dressing for a puncture wound in the chest cavity. And inside as well is S-folded gauze, which, as opposed to rolled gauze like you would see in the back of an ambulance or in a pharmacy, that S-fold, once you tie a knot in the end of it, you can use it for wound packing.
Yep.
And I'm sure we'll get a little bit more into wound packing, but that is for wounds that you can't put a tourniquet on, or a tourniquet is not is not appropriate. Right. A puncture wound, or a wound in the abdomen or in the junction, any of the joints, which we call junctional wounds, which a tourniquet's not going to work. I just like it because it gives me more capabilities than just this. However, nothing, or an Israeli, I'll take the Israeli. So, little roast, not a lot. Was ist los?
small little like doctor tourniquet to draw blood and stop the small bleeds. I love those things. They have done, they're great.
So, how does it? Oh,
Yeah.
yeah.
Small arms, small limbs.
I would
And I can cinch it down.
be hesitant. Not saying it doesn't work. I'm not familiar with it. There was one at one time that I fell in love with. I thought it was great. It looked like almost like it had been designed from a wire tie. And it looked good. It did a lot, and it was enough where if you really honk down on it, you could get that reduction in a radial pulse.
Mm-hmm.
Well, one of my coworkers also teaches at a medical school,
Yep.
and he took it in and took it into the lab and actually used it on one of his students and actually used the ultrasound on it, and it did not stop. So I'm not going to say yay or nay on this. I know one that was like it, that for really stopping the bleed in a traumatic arterial wound, the one I had like it did not, at first blush, like, yeah, okay, that works. And then did some more digging and research on it, like, and some, like I said, some data gathering in a lab, and like, okay, no, not so much. So that's why I kind of stuck with either the North American Rescue Cat Tourniquet or that soft T tourniquet. So, is it better than nothing? Sure. I'm not gonna knock it, but that wouldn't be my first grab. Nitrile gloves, XL, travel size, black. Sure. Why not? I like lighter colored gloves because I'm not technical.
Yes.
And if I'm ever having to do an assessment on a patient that's fallen and I'm looking for other bleeds, like if a patient's laying on the ground and I'm running my hands under their back, I want to be able to look at my glove real quick and see if there's any blood. So a bright orange or light blue or purple is going to show that blood quicker than black.
So just for the information of everyone, I did not get the black gloves to be tactical. I got black gloves because that's the size they had in extra large.
It's fair enough. Even though my work gloves are XLs, I wear larges in medical because I don't like that extra. I want to be a little bit tighter and a little bit more form-fitting for when I'm I need a little bit more dexterity. But that, again, that's 18 years of learned. All right, so that's the first compartment we have here. Yeah, it's passing. I'd use it. All right, so anything? What do we have here? Bleed stop.
Best thing in this world. Now, well, the caveat of this is it's not recommended to use this much anymore. But if you have somebody who's on blood thinners or a free bleeder and they have a small scratch, that's worth its weight in gold every time I've ever had to use it.
So, is this the clay or the chemical? This is part of the clay one. There was different modes of this, different ways for the hemorrhagic packing, and
that's the chemicals that burns like crazy.
Yeah.
I believe it's the chemicals anyway. I know I've used it once and it burns something awful.
We don't use these in my world. I'm not going to recommend it. I'm not going to say against it if it's what you use to save someone else's life. But let me go ahead and say, as a EMT, no. Let's do pressure dressings, tourniquets. This creates problems for surgeons later on.
Yes, I wouldn't.
Do your own research. If you decide you want to carry this in your pack, these are in none of mine.
I keep that in my bag, a little nick, and they will bleed something awful.
So, it's just the when you had the chemical ones that actually burned, it cauterized the wound.
Yep.
And then the other ones were clay, and then it became a problem. All right, tourniquets, Benadryl, diphenhydramine, Oh,
Anti-diarrheal.
yeah, antidiarrheal. If you're out in a wilderness setting, yeah, sure, you get a patient who becomes, and this is some of that wilderness medicine I taught about. The difference in street EMS and wilderness is the how long it's going to take you to get to an advanced level of care. So if he's your patient and it's not a call for a helicopter thing, you may have to keep up with that patient's oral intake, which means you got to keep up with what the outtake, and diarrhea can absolutely lead to dehydration. So yeah, follow as instructed. What is this?
That is another type of tourniquet.
Oh no,
El Cheapo tourniquet.
Yeah, no, that is too thin to do any good. That's like using shoelaces or a belt.
That's about what it's for. I got nothing else that comes out.
I would use a drop cord and a stick before I use that. Again, if you got nothing, it's what you don't do is going to kill your patient. You know, I've said this before in classes, you know, if you have a sterile dressing, yeah, let's use that as opposed to the dirty one. But if all you have is a dirty, oily rag and that's what you're going to use to stop the bleeding for me or nothing, well, use the dirty, oily rag. We'll fix it later. So keep trying, keep being creative. How many patients are you planning on treating with this? Because about the time the first tourniquet comes out, the party's over for me.
Well, when I got them, they came in packs of 10.
Ah, okay. Yeah.
So I figured, you know, I got extra room.
Yeah,
Let's stuff it in there.
If I'm out somewhere with my family or we're on the road and something happens and I got to use a tourniquet, that trip's over. We're done. So a lot of stuff in here can all be replaced with one.
Yes.
North American Rescue Cat, right? CPR mask, absolutely big deal. If you don't know CPR, learn it. This is one that can actually be used and EMS when and if they get there, they can tie their O2 line into to help increase, or this will
Bag the patient.
Plug into a BVM, a bag valve mask, with all the that capnography that we're using so much now in that field. But yep, absolutely. Adult, large child, not so much infant. Ibuprofen. Let's see what all we have in here. 4x4. Yep, 4x4s are the workhorse. They're the staple. Oh, Lord.
All the Band-Aids.
All the Band-Aids. I don't want to hang out with you. You have way too much going on. Triple antibiotic. Yep. Hand sanitizer. Big deal there. Hand sanitizer. Especially if you're out and about. When we talk about in the wilderness setting, so much illness in wilderness comes from improper hygiene. The majority of the injuries we see are burns from cooking, but hand sanitizer, big deal. Antibiotic ornament. Hydrocortisone cream for them itchies. Sure, why not? Burn cream. Depends on what it is. A little lidocaine in there, and she's gonna read that top one. More glovies, some adhesive bandages.
Benzocaine chloride, I believe.
Sure. Alcohol prep pad. Yeah, you're not really going to be using that sting relief. Antiseptic towelette. That should be, yeah. That's benzocolonium. Yeah. Yeah. No, you need to upgrade your shears in this. Those are, that looks like it came out of a kid's play sewing set.
Yep.
Come on. You need to do something. Look, trauma shears are $2-3, and you're gonna have a perfect set. It'll cut through pennies. Don't do that. It kind of dulls them, but even the $3 trauma shears cut through pennies. They're designed. They cut. What would I add? I'd add North American Rescue cat tourniquets. Obviously 27 of them because, geez, I don't know where you're going, but it's bad. I do that. I look at the olease, maybe a small bottle of normal saline, just a small bottle for wound irrigation and flushing, and then 10, 20, or 30 cc syringe just so you can draw up that saline and flush. You've got the stuff to clean wounds with, but what we really talk about is washing them, getting the trash out, getting it clean, and I don't mean scrubbing hard with dial. I'm flushing with clean, clear water. Mm-hmm. That would be, and baby aspirin.
I have some in there.
Do you?
Take a.
Yeah, I missed it. Perfect time for some sweet tea. It was on the 8th day.
I made sure that I threw a bottle of that in.
Oh, there's baby aspirin at 81 milligrams. So the correct dose for an adult patient experiencing chest pain that does not have a bleeding disorder. That is something you need to find out. You need to know, as long as they don't have any bleeding disorders, is 325 milligrams. Well, 81 times 4 is 324 milligrams. What's a milligram among friends? 4 of these for a patient having chest pains that may have a cardiac event. Aspirin is ASA, acetylsalicylic acid, and it's a rough drug. It will, if ulcers, bleeding disorders, none of that gets this.
Awful on the liver.
Yeah, but I'd rather have a hurt, damaged liver than die from a cardiac event. Oh, BZK. Yeah, I can't roast it well. I mean, it's a first aid kit, and the whole thing about a first aid kit is looking at what may or may not happen and thinking, oh, it can happen around me and helps. Let me be my own help. So just making the decision to put a kit together to be responsible for your own health and well-being is already ahead. My wife gives me a hard time about it, that whenever we go on a road trip, I'll grab a couple of my kits and throw them in the back. And she says, do we really need that? And I always answer, I hope and pray not. But when I need it, and I don't need to go looking for it. And I'd rather have it and not need it than need it and not have it.
Yeah, like I said, that
it's kind of like a parachute.
That's it. You know, that bag there has a companion. About 60% of the time, I keep a dedicated IFAC kit that goes with it, bleed out kit, blowout bag.
Yep.
That goes with it almost all the time. And then if I don't think I'm going to need it, and I'll just take that. And I can probably, I think I could probably get by with that in town. I'm close enough to help where I could do something.
As long as you're able to make communication with people, you can get by with that for a lot longer than town. And I say that so much of what I would teach in wilderness medicine isn't about the equipment. It's about thinking outside the box, so to speak, and being creative, and just mostly knowing how to prevent it, but then once it happens, knowing what to do with it. You're not taking an AED with you on hikes or out in the wild, but if it's if it's something that can be managed and extend the patient's life, like a serious cut or a tourniquet, you've got several hours before that tourniquet needs to come off. It's not the 2-4 hours we were talking about, 20 years ago. We've learned that. Orthopedic surgeons have found out because they're putting tourniquets on doing knee surgeries for 8 and 10 hours and releasing those tourniquets and coming back and having no deficit on the lower extremity.
Yep.
So, now if that tourniquet comes out and you are away from town, as you so put it, you need to be making communication with someone and find a helicopter to get there.
I have a know a guy that's pretty decent in communication. He's in touch with people.
Yeah, right. So it's about just knowing, obviously prevention, but then knowing the next steps once it happens, right? And so I'd hike with that kit. Sure, I'd go out and about. Like I said, a couple of things I'd add to it, and that's just things I've learned along the way, which is necessary. There's nothing quite as good as that 60cc syringe and a bottle of normal saline to flush trash out of your eye.
That'll save the day a lot of time.
If you're, plastic bags, pieces of plastic. Did I see I didn't see an emergency blanket in there.
You did not. That's an eye bag.
That, okay. Emergency blankets, the foil ones, that's very big to prevent hypothermia for a patient who's been cut and bleeding profusely. Hypothermia will onset as the body loses blood and its ability to thermoregulate. Headlamp.
Always keep a flashlight in my pocket. Always.
Mm-hmm. Where do you keep the batteries to your spare flashlight? Where do you keep your spare batteries for your flashlight?
Spare batteries? All my flashlights.
In your spare flashlight. Don't ever just carry one.
I got one on my key, one on my bag, and
every bag of mine, if it has one headlamp, it has two.
And the secret I've learned is nothing I have battery flashlight wise is batteries in the world. Traditional batteries. Everything is USB superchargeable. Everything. So if one goes dead, I pull the second, I charge in the first one.
No. I mean, and if that works for you, if you have that ability, but you think about with my side gig being out in the woods,
Yes.
I just make sure all of my headlamps, all of my flashlights, all run on the same batteries.
Yes, all USB-C.
All AAA.
That's standard, man. You gotta have that one, because if there are 12 cords, I'm gonna lose 11 of them.
Oh yeah. So, no, man, that's well, I appreciate you, having me in to pick my brain a little bit. I like it. Anything else I can do for you with that?
That's all I really got. And remember, guys, as always, don't forget, like, comment, share, subscribe. I appreciate your time.
Any comments? If they comment any questions, just make sure I know.
Absolutely. You'll be the first person I send them to.
I'll either answer as honestly as possible, or I'll make it up. And because you asked the question, that means you didn't know the answer either, so you'll just believe me.
All right, guys. Till next time.